Hi, I'm Mauro Podda. I'm a consultant surgeon based in Italy at the Department of Surgical Science of the University of Cagliari. And I'm going to show you the results of our latest publication in the British Journal of Surgery entitled Laparoscopic versus Open Colectomy for Locally Advanced T4 Colon Cancer, a meta-analysis of clinical and oncological outcomes. We know that colon cancer accounts for 9 to 10% of all tumors in the female and male population, and that approximately 10 to 20% of patients diagnosed with the colon cancer present with locally advanced tumors invading the surface of the peritoneum or directly invading other organs. Although several treatment options for colon cancer, including molecular target therapy, adjuvant chemotherapy, and radiotherapy, may have the potential to decrease disease recurrence after colorectal resection. Radical surgical resection, also known as R0 resection, appears to be the main predictor of favorable long-term oncological outcomes. However, as the classic Color and Barcelona trials excluded locally advanced T4 tumors from the analysis, high quality, safety, feasibility, and oncological efficacy profiles of laparoscopic T4 colorectal cancer remain to be assessed. The aim of our study was to systematically review the currently available evidence on laparoscopic colectomy for T4 cancer, to evaluate short postoperative and long-term oncological outcomes after laparoscopic colectomy, to compare the above with conventional open surgery using the meta-analytic method and the GRADE approach. We implemented the PICO structure in our meta-analysis, and we have assessed the following outcome measures: postoperative mortality and morbidity, R0 resection, recurrence rate, and positive margin from an oncological point of view, conversion to open surgery, estimated blood loss, operative time, the mean number of retrieved lymph nodes, the length of hospital stay, and survival outcomes. 24 studies were considered eligible for entering the meta-analysis, and all of them were published between 2013 and 2020. All studies together analyzed data of almost 30,000 patients divided in the laparoscopic and in the open cohorts. We found that the mean estimated intraoperative blood loss was significantly lower in the lap group compared to the open group, and that the two groups showed equivalent results in terms of operative time. There was a statistically significant, however, statistically significant decrease in the mean length of hospital stay among patients operating on with the lap technique compared to those operating on with our open technique. And we found also that lap colectomy for T4 cancer was associated with a statistically significant lower rate of mortality compared to the open cohort, with a lower complication rate, and with a statistically significant higher rate of Clavien-Dindo 3-4 complication was detected in the open surgery group compared to the laparoscopic group. The meta-analysis revealed that no statistically significant difference in the radicality of surgical resection was found, and the same was for the recurrence rate. However, according to the GRADE criteria and the GRADE analysis, we found that the overall quality of evidence was very low to low for the main outcome measures, except for mortality that was rated as moderate according to the GRADE criteria. In conclusion, our meta-analysis has demonstrated that patients who underwent lap colectomy as a surgical treatment for locally advanced T4 colon cancer were able to benefit from the advantage guaranteed by the laparoscopic approach, whilst at the same time achieving equivalent oncological results compared with the open technique. However, future well-designed, multi-center, and possibly randomized controlled trials focusing also on the analysis of patients' quality of life after surgery are awaited and will possibly provide more strong and more convincing evidence on of this approach, especially regarding T4B stage tumors. Thank you.